Welcome back. Now tonight we're exploring a crucial topic for all healthcare patients, the topic of self-advocacy. Knowing how to communicate your needs and concerns can make a real difference in the quality of care you receive. Joining us this evening is Dr. Hapulile, a specialist physician, to share practical tips and insight that can help you get the best possible care. Doctor, good evening and welcome to the show.
Good evening, dear. How are you?
I'm good, thank you. How are you?
Fine, thank you.
This is such an interesting topic, and I was thinking earlier, like, where do we get this fear from with expressing ourselves to our health practitioners? And I think it comes, from when we were little, and our parents would threaten us with taking us to the doctor, and we sort of grew this fear, and now it's affected us in our adult lives. But doctor, firstly, what are some of the effective ways that patients can communicate their concerns and needs to their healthcare providers?
Yeah, I think that fear that you talked about people having fears for their healthcare providers, is actually something that even within the medical profession ourselves, that we have also observed and we also find problem with, because we don't want to practice medicine of autocracy. We're not God, we are not the know-it-all. So what we would prefer is that we are the experts of the scientific knowledge, and then you as the patient, you are the expert of your own life. You are your own expert, you know your body, you know what affects you, and so it's almost like a meeting of the two experts. So I think one of the things that patients can practice is just self-confidence and self-awareness, and to say it is okay. Like, it is okay for me to believe that I know best. It is okay for me to believe that I know my body, that I know these things, and this is a stranger, this healthcare provider is a stranger, so it's okay to have that confidence to say that I know best.
Yeah. How can patients make sure that they're well informed about their medical conditions, and also treatment options so that they can make empowered choices?
Yeah, sometimes when you go to the doctor can give you a diagnosis sometimes, but sometimes not. Sometimes it's an accumulation of symptoms, tests that need to be done, and then evaluation to be decided on what is the most likely diagnosis. So the expectation that a doctor knows best or will always have an answer is actually wrong, because most of the times the doctors actually don't know. So if you do get a diagnosis, the doctor tells you they think this is what's wrong with you, you go up and read. You have to go read around at your own language, at your own time, let it settle in. Talk around to people who are having the same condition, and then you come back to the doctor with questions to say, this is what I read, this is what I understood, what do you think about this, what do you think about this, why are we choosing this treatment option as opposed to this one, and just have a communication between the practitioner as well as the patient.
Yeah. If a patient feels, for example, that their symptoms aren't being taken seriously, how can they, effectively advocate for themselves?
Okay, so most of the times when you go see a doctor, there's always somebody else around. So what you can do first, you can tell the practitioner that I want to just talk about this, how I feel about this treatment. To just be honest, to say, I understand that you're saying this, but I have some concerns. And in most cases, the doctor will listen to that. However, if that does not work, you can then just ask, if there's a hospital facility, you can talk to the nurses who are around. They can also help you. Usually there will be a nurse in charge, and they would also be able to provide some assistance. And if you feel like that's not actually working, and then you follow the steps for complaints. So you can go to the complaints offices, you can go to the council, the health professional council. They're very good at just assisting patients and making sure that the public is safe. And usually those are the steps. The complaint officers and the health professional council usually would have to retain that. Other ways, also write an email. Sometimes when you're talking in person, the doctor might also feel some sort of way, but when you write them an email and they read it, they can take a time to absorb.
They're so busy. Shame.
Trust me, for their patients.
Yeah.
Healthcare is a patient-centered thing, and the patient comes first. So what we want to do always is to provide the best possible care for our patients. And sometimes we might not always get it right. Sometimes our moods don't meet, our expectations don't meet each other on the way. But what we want is the best patient care. So trust me, they'll find time to try and just discuss the matter and form a way to make it happen.
Dr. Hapulile, second opinions can be very valuable. Why should patients consider them? And what's a respectful way to approach this with your doctor?
Well, you can ask them, especially if you've brought some of your concerns to the front, to say that I was worried about this, and then maybe the doctor did not address it properly. You then say, can I seek a second opinion? And then most of the time, again, like this is part of the healthcare. You do need a second opinion.
Yeah.
They will advise you. They will say, yes, indeed, go seek a second opinion to somebody else, and you will then be able to compare the two directives. I think sometimes when you're not heard, it manifests itself in different ways. Frustration, anger, fighting, you know, and you don't always have to have those emotions. If you just accept that I was not happy with that treatment, you sit down, you talk to the provider, and then you guys come to an agreement. If you can't, you then do go and seek a second opinion, and you should usually they give you a different opinion as well.
Yeah. Finally, for those who may, be facing communication barriers or misunderstanding with their healthcare providers, what advice would you give to them, for overcoming these challenges?
Yeah, I think one thing that we have to accept is that us as doctors, we're not lost to how intimate the relationship is between a patient and a doctor. This is the most secret situations that can be. So, and sometimes it's a bad news that it's news that is not so wanting, that you might not be able to want. So sometimes having an additional person present to help you hear the information that you're being told, because the elements of news acceptance, they can be denial, they can be anger, they can be regret, they can be all those emotions, and they manifest themselves in different ways. So if you're having a communication barrier, ask somebody else that you trust to join you in the consultation and to see how this can be if it's a matter of information or if it's a matter of attitude. If it's a matter of attitude, then you can then seek other professional assistance from the health professional councils or from the regulatory bodies to assist you on how to manage this. Usually, most hospitals have complaints officers. There's usually a step to talk, if you're not happy, who to talk to and who to complain to. Just ask around. If I'm not happy, who must I talk to?
Right.
And most of the time, they'll be able to assist with that. Yes.
Doctor, thank you so much for joining us. Yes, you'd like to add on something more?
I just wanted to let the public know that, there's a patient charter that the government has out, the Ministry of Health has a patient charter that's out. It's on the internet. It's freely available to anyone. To just Google it and to read about your rights as a patient, because you do have rights, and it is your duty to receive quality health care. It is your duty to ask questions when you don't understand, and it's your duty to then seek a second opinion, your right to seek a second opinion if you're not happy. Additionally, I think when you are seeking, one of the points I just wanted, my colleague actually said, I must make sure to say this, is that sometimes when you're having somebody in hospital, and you're getting information, there's always this person knows this, this person knows this, but it actually helps if there's a core group that communicates with the healthcare providers, and then that core group sort of gets the information and then is able to disperse the information to the others. So to always identify who are the people in the family who can actually receive this news, and then you go and discuss that with the family, and to not always be different people, but that also causes a communication breakdown and frustration from both parties.
Some doctors have to repeat themselves. Yeah, they've already shared this with 3 other people.
Yes, and that also affects the communication breakdown. But really, I would prefer all my patients to be empowered. Come with questions, come with Google, and let us dissolve all that kind of stuff.
Dr. Google.
It's
Google
okay.
is not trusted.
It's not trustworthy, but let us then work through that. Let us work. So the Google is not trusted, but let us work through that, and let us build a relationship of trust. And because sometimes the diagnosis can be wrong. And we need to be together in that journey of this was a wrong diagnosis, but we're actually we didn't know this, but now we know this now, so we're changing that direction. And there's a relationship, an intimate relationship like that, we have to allow for that kind of moments to be present.
Indeed.
The other thing, again, sorry, last week was medicine week, and part of it was the adverse reactions of medication.
Right.
And again, some medications have got side effects. So you have to ask your doctor, what are the side effects of this medication that you're prescribing me? So that you know what to expect. You then know which medication gives you which side effects. That then helps you to say that this medication works for me, this one doesn't work for me, and you actually get to know which one is best for you and which one was not so good. And it's okay to then come back and say that I think I had a side effect from this medication. Is there no other option that we can try?
Good tips you've given us indeed this evening. Thank you so much for being here.
No, it's a pleasure.
That was Dr. Hapulile speaking to us there. On that note, I think we're wrapping up today's edition.